I'm Dr. Michael Stampar, and I'd like to welcome you to Spago Day Spa Salon and Medi-Spa, where you can have an experience rather than just a service. In performing the Pelleve, we always apply the treatment gel first. I always apply gel slightly beyond the area that I plan on heating, so that if I slip, I don't hit any dry skin, because hitting dry skin is one way to burn the patient. The second way to burn the patient is to activate the handpiece. Keep your eyes closed, please. Activate the handpiece prior to touching the patient. So we always touch the patient first and then activate the handpiece. And using a 15mm handpiece, I'm going to start her at about a setting of 30. And I start with continuous motion to make sure that my gel is applied and distributed. You only need enough to make it glide. And we're going to work on her forehead and crow's feet and upper lid crease here. I'm not using the lid shield because I'm only working on the upper side of the brow. I will use the lid shield if I were working on the eyelid proper for crepiness. So on the lower face here, I can touch her skin because I have no gel on my fingers and there's no gel on her face, but if you're touching an area with gel, you'll need a glove. So she reacted to the temperature there, and we'll use our infrared gun and show that the temperature is 41 at one point in the low 30s. Always scan the temperature so you're not taking single measurements, and know the general temperature of the area. So a single pass would be to get to temperature, and in this case I'm going to apply ice to force contraction and to take out some of the compliance or softening or quote-unquote squishiness of the skin. All solids contract when heated or when cooled. I'm going to use this Pelleve roller for cooling. Now I'm not protecting the skin with this. I'm using this to force contraction vertically to take out some of the compliance of the skin, firm the skin, bring it closer to the skull so that it'll contract horizontally. And I'll do that for 1 or 2 passes in the forehead, and you can actually see a stiffening and feel a stiffening even after a single pass. Now I'm going to turn the device up to approximately 65 in treating the mid-face, which is much thicker, not directly over bone. And I start from the bottom and work along the jawline, because the whole purpose of treating the mid-face is to contract the skin and the softening in the face that is trying to gravitate to the jawline, maximize the contraction in a J shape from the nasolabial fold up to the temple, and push the malar mound up, and only use a small amount of heat for skin smoothing along the malar mound. And I'll emphasize flattening the high side of the nasolabial fold. Check the temperature, 42. This comes with experience. I pretty much know by color and by heat, sensation on the face, and by her near flinching that I'm right about the temperature that I'm trying to reach. There's 42. When I first did this procedure, we called it the say when lift and waited for the patient to respond. After several patients, you will get good at knowing when to move along. I tell the patient, don't let it get hot. If it's getting to the point where you think I'm going to hurt you or it's going to be too hot, tell me, so that you don't pull away, and that prevents any spark gap. Reassure them that it doesn't have to hurt to work, so that they don't tough it out, so to speak. So I'm icing here because I really feel that the contraction of the solid components of the skin that I've heated are ratcheting down with each treatment, with each pass. And what I see is that in a single pass, the compliance of the skin is markedly reduced, the movement in that skin. There's a three-dimensional contraction, and I see that with each subsequent pass. And I will talk about the heating controversy in the chapter, the cooling controversy in the chapter. But I truly believe that cooling the tissue forces contraction and gives a better result.